Keith, ladies and gentlemen, from a beautiful part of the world and part of Flinders University. Will you please make him feel welcome, Dr. Keith Miller.
I'm glad I had my little drink of water there because I'm a bit dry after all that. But that was fantastic. It's been great. I really feel like I'm part of this conference, which is fantastic. You know, I came Thursday afternoon and just participated, enjoyed yesterday and getting involved with people. And I've worn a white shirt today because I think I should officially become a member of the White Shirt Brigade. So it was really interesting yesterday. I approached people at the breaks, at the lunch times. Not a lot of people, just a few, just had a chat, just engaged, and found that really helpful, really interesting, and the sense of passion and commitment of everybody here is really fantastic. I want to speak on a research project, I'll get my little clicker, which Families SA, Families South Australia, invited a colleague of myself to conduct. So colleague Professor Carol Irizarry wasn't able to come to the conference, but she's very much a part of it in the sense that we developed this presentation together. We've called it Meat and the Sandwich, and I think you'll get a sense of why we've done that as I go along. This is my, oops, hang on, keep going. There we go. This is my first time in this beautiful city, and so please accept this acknowledgement as a true gesture of respect and a genuine appreciation of this beautiful land on which we're privileged to meet. So I wish to acknowledge the Larrakia people, the traditional custodians of the land we gather on today, and I pay my respects to their elders, past and present. Carol and I were invited by Families SA, now part of the Department of Education and Child Development in South Australia. So it's the Child Protection, effectively the Child Protection Agency department in South Australia. Different jurisdictions have different names for the agency, but essentially they do very similar kinds of things. So we were invited to do a research project to look at relative kinship care as one aspect of out-of-home care. Within the broader context, we wanted to investigate kinship care from the perspective of Aboriginal carers, non-Aboriginal carers, and the staff who worked within the system. We wanted to gain some insight through their eyes of their lived experience. There are similarities between foster care and kinship care, but there are also some significant differences. In South Australia, kinship care is increasing, and I think that's both from a pragmatic perspective due to funding constraints and the declining availability of foster carers, but also the philosophical perspective of Families SA, that it's preferable to maintain the child within the family structure if possible. Good and bad aspects to that, and I'll mention some of those as I go along. So here is a definition of relative kinship care. And I was talking to Connie this morning, and I recognised that what I didn't actually mention in my presentation, but which I will mention now, is that there are kinship carers officially recognised, and there are unofficial kinship carers. And I know there are some here today, and so I don't want you to feel that I'm ignoring your particular concerns. I very much include both officially recognised and non-officially recognised kinship carers in what I'm talking about today. It's quite a broad definition. Relative kinship care is a form of out-of-home care where the caregiver is a relative other than the birth parents, considered to be family or close friend, is a member of the child's community in accordance with their culture, and that's true with Indigenous families, but also with refugee families. And I've had something to do with those children as well. and that there is reimbursement for care of the child. So that's the definition of relative kinship care from the Australian Institute of Health and Welfare. For Aboriginal and Torres Strait Islander children, a kin carer is a member of their community, a compatible community, or from the same language group. So really the emphasis is that carer has already developed a previous connection with the child. Supposedly the child is entering a family situation which is somewhat familiar. And so I guess one differentiation between foster care and kinship care, and I'll be interested to hear anybody who might have a different perspective on this afterwards, but as I see it, for foster carers, the child enters a context which is foreign to them, meaning that the adjustment which the child needs to make is even more stark. Now, just some numbers, and I'll need to provide a bit of context, but in the 2012 financial year, and this information I gained from the Australian Institute of Health and Welfare website. It was the latest that I could find, and this is a month ago, and it's talking about Australia-wide numbers. And the interesting thing to note is the change between foster care and kinship care. In 2009-10, there were 33% of children in relative kinship care, and this increased to 54.5% in 2012-13, and I'm pretty confident that that proportion has increased. So there's an increasingly important role in Australia's formal out-of-home care system, and this development is true internationally as well. As I mentioned earlier, the decision for this has been both a pragmatic as well as a philosophical choice. So, on an average day in 2012-13 in Australia, there were 23,354 households approved to provide funded out-of-home care placements. And what that means is, I guess that rather than looking at one particular day or the end of the financial year, they've averaged out over the course of the 12 months and called it an average day. And this is the numbers that they gained. So on an average day, 23,354 households were approved to provide funded out-of-home care placements. On an average day in 2012-13, 31,966 children were in out-of-home care. Nationally, the rate of children in out-of-home care was 7.8 per 1,000 children, but 11.7 in the Northern Territory, so considerably higher than the national rate. In terms of Indigenous children, at the 30th of June 2013, 13,952 Aboriginal and Torres Strait Islander children in out-of-home care, 57.1 per 1,000 children. Sobering numbers. Nationally, the rate of Indigenous children in out-of-home care is 10.6 times that of non-Indigenous children. Now, these first few slides are an introduction to what I want to get onto. There's a significant story in each of them, but I won't dwell on that story. Rather, I'll look at the particular project in which I became involved. So, as I said, a project which Carol and I were invited to conduct. We considered a number of individuals and groups. We sent out a staff survey right across South Australia, so not just Metropolitan Adelaide, to all Families SA staff, and received slightly above a 20% response rate from staff. Now that doesn't sound very good, 20%, 1 out of 5, but it's not bad, and it's pretty standard in terms of a survey, considering the pressures under which staff work, and their responses were voluntary. So about a 20% response rate to the actual survey we sent out. The situation in South Australia continues to change, and that's true Australia-wide as well. One key differentiation here, we interviewed 44 carers. So we had both focus groups and individual interviews with carers, and that included 11 Aboriginal carers and 33 non-Aboriginal carers and 81 staff. So as I said, we had focus groups as well as meeting with couples and individuals. And in terms of the support workers and the case workers, we interviewed them in focus groups as well as individually, and in one case on the phone. Now, one differentiation I'll make here, and in talking with a few people yesterday, it's different in different jurisdictions, but in South Australia, the case workers are responsible for the children. The support workers are responsible for the carers. And I think that is different across Australia, but that was the situation at the time when we conducted the survey. So here are a selection of the key findings. In terms of the Aboriginal carers, some things they reported: support workers primarily give carers support. They appreciated the care that was provided. The case workers primarily supported the children. Both types of workers were perceived as being helpful. And they wanted workers to be energised, kind, and not too nosy. And that was interesting. Not unsurprising, but nevertheless, that's one of the things that came out. As I said before, a major difference between foster carers and kinship carers appeared to be to whom the carers felt responsibility. So the foster carers felt they were fulfilling a role on behalf of the state in caring for a child, and they understood that they were doing that on behalf of the state. Kinship carers felt they were fulfilling a role on behalf of their family in caring for a child when the parents were designated as being unable to provide care. I don't know how that registers with you. If maybe those who are kinship carers and foster carers here, whether you're aware or appreciate that kind of difference, whether it even registers with you, but that was certainly one of the things that came out to us. And it flavoured all of the results that we found. In terms of the issues, keeping the child safe while maintaining family conflict was often difficult, or family contact was often difficult. They wanted to keep the child safe from being drawn back into the family environment which had previously been so toxic for the child. And that was a really important emphasis for them. So they wanted to keep the child safe and yet somehow maintain family contact. They wanted to maintain cultural education for the child. They wanted to avoid family reunification if the child was not safe, if they felt the child would be unsafe in that situation. They didn't always know the right questions to ask the agency that provided the care for them and for the child. And one of the issues that was constant was the frequent caseworker turnover. Not an issue that, it's not best for the agency, it's not best for the department, but it just seemed to be inevitable. Constant changing of the caseworkers. So here was a quote from one of the carers. With kinship care, you get a phone call at 2 a.m. and you're not just dealing with a child in crisis, but a whole family in crisis. And that can be devastating for family members and emphasises the major, as I said before, what I found to be one of the major differences between foster care and kinship care. And this is true for both Aboriginal and non-Aboriginal carers. How devastating that can be. It's not a surprise. Usually other family members are aware of the situation surrounding the birth parents. But when it finally happens, it's right there on your doorstep and you can't avoid it. There's no getting away from it. In terms of the non-Aboriginal carers, two things they reported. They felt affirmed and supported by the support workers. And that was true right across South Australia, both in Metro, in Adelaide, but also across the country, rural and remote. And that was really important to the carers. They really needed and felt a strong sense of support for those professionals who were supporting them in their role as carers. But they didn't feel that the organisation with whom they had to deal, Families SA in South Australia, other agencies, other departments in other states, they didn't feel that that organisation fostered respect amongst them. So there were issues that they identified as concerns. There was a consistent feeling amongst non-Aboriginal carers. They were given all of this official information to read. They were like given a handbook. You know, they get the child at 2 o'clock in the morning. A couple of days later, a caseworker would come around and give them this information. And no one ever seemed to explain it to them. It was often written in jargonese, language which is incomprehensible to ordinary people who don't have a law degree. They're trying to improve that now, but it's still that wealth of information, written information, which is really hard to get their mind around. Secondly, everywhere we went for interviews, the message was consistent. They desperately needed respite, but it was rarely provided or very inconsistently, so they couldn't depend on that respite. Often these carers were older, tired, dealing with a severely traumatised child. They felt the child had been left too long with the birth parents, and the child had become seriously affected by the behaviour of those parents. A significant point of frustration came when a young caseworker came to visit from Families SA and explained to these carers how to parent the child. People who are often now grandparents found it humiliating for someone who'd never had a child advising them how to bring up a child. And that was a consistent message that we received. And I hear some rumbles in the audience, maybe that's been your experience as well. Another issue was reunification. This is an emphasis now within Families SA, and I think all jurisdictions around the country. There is a sound philosophical decision or philosophical basis to the choice, but it is a policy choice, and it doesn't always work. So I was talking just a month ago, around about a month ago, I was talking to a kinship carer, and I was just sort of passing and going to say good day, and about an hour and a half later, we said, see you later. She sort of unloaded on me. She has 2 boys. One of them, when she got them, they were pretty young, and now they're quite a bit older, obviously they're teens now. One of them copes very well out of the family situation, doesn't feel any great need to visit the birth parent, but if he does, okay, and once he's had the visit, he'll come back home again, what to him is home. The other one was younger when taken from the birth parents, severely traumatised. Whenever there's a requirement to visit the birth parent or some of the other family members, and it takes them 3 or 4 days a week to settle him down again. Now there are individual situations which need to be taken into account, and often can't be, policies can't cover that kind of variation within children. So kinship care is a way of retaining the family structure even if the child is not with the birth parents. But there needs to be some awareness of the variation within children. Another quote from a carer: "We enrolled the child in kindergarten and school. We were told that we had no authority to do this to a government child." So the question continually arose in the minds of carers: who has responsibility for what? They never felt certain. A quote: "If we take a vacation and want to take the child with us, we have to get permission. And that can take months. So how realistic is that?" All of these issues continue to be discussed with Carol and myself. Any one of these issues was not overly significant in itself, just frustrating, but taken together, they became, or they felt, almost insurmountable. So this is where I come to what I chose as the title for the presentation, Meat in the Sandwich. Carers often expressed in various ways that they felt like the meat in the sandwich. They felt a deep obligation. It wasn't even a choice they had to care for this child. Most often the child arrived at a point of crisis. Sometimes this was the middle of the night, not always. They were attempting to care for the child as best they could. They often needed to be relating to their own adult son or daughter, or niece or nephew, and extended family members with different points of view. So trying to balance all of that whilst caring for a child. They were also required to satisfy certain obligations to a government department whom they often viewed as interfering. And yet, on the other hand, families, as say, the Child Protection Agency felt they had ultimate responsibility for the child. They did. The child was under the guardianship of the minister. So it was their ultimate responsibility if anything happened to the child. So they had to interfere in what should have been a family situation. And some of the staff felt really uncomfortable and awkward doing that, but they felt that was their obligation. New expenses with the arrival of a child. Startup expenses were often considerable. The child came to them, often with only the clothes they were wearing. The carers felt the child was dumped on them with little prior notice. They knew things weren't quite right, but they weren't expecting it at that moment in time. They were willing to take responsibility, but they felt there had been little prior indication. They were aware of issues, but they often did not realise the intervention was going to happen right then at that particular moment. So the carers often had to find extra clothing, sometimes a bed or a cot, bedclothes, school gear, toys, and so it goes on. There would be additional health expenses due to the trauma the child had experienced. Sometimes this meant extra visits to a medical centre or even a hospital for physical health matters, and often visits to psychologists. We spoke to someone who lived about 450 k's from Adelaide. She was an auntie, and so, I think in about her 30s from memory, and she had a couple of children, I think it was a couple of children to care for. And she had to bring the child regularly to Adelaide for medical and psychological care. She had to find somewhere to stay. There were all of these expenses, the costs of the trip. She was on a pension. And so it became really difficult for her to care for this child, to give it the best care that she could. They were more than willing to take on these expenses. They didn't resent that the child needed it. An allowance did come for this, but it was often sometime later that the reimbursement came. So again, stress, big time stress. Their whole life had been thrown upside down. All of their plans had gone out the window. They suddenly went from being a grandparent or an auntie or an uncle to being a parent. A whole change in mindset and behaviour. We spoke to carers who had happily recently retired, had plans for what they were going to do in their retirement, bought a caravan, all those kind of things, who now sometimes had to move interstate or some distance within the state so they didn't disrupt the child and could maintain the child with other family members. So they moved themselves to be with the child. It was an enormous upheaval, which they often hadn't planned for, and it was hugely traumatic. So the trauma for the child is recognised, but not always for the carer. And I think that's a really significant point. Okay, now I'm ploughing through this fairly quickly, so happy to talk with people afterwards if you wish. As I said, we talked to carers, got a snapshot of a view from them. We also talked to staff. And my very strong sense in reading the questionnaire responses, and then with meeting with staff in the focus groups and individually, was that staff were highly committed. They cared about fulfilling their role professionally and in a caring way. But this was often not the impression we gained when we spoke to the carers. But it was true. Carol and I interviewed staff from a range of metropolitan areas, so right across Adelaide, peri-urban, which is kind of the region around the metro area, so the Adelaide Hills, south of the city down towards Victor Harbour, and rural areas. We attempted to gain a good spread of views, so we travelled to Mount Barker, which is, only 50 k's out of the centre of the city, or 40 k's. We went to a place called Mount Compass, which is down near Victor Harbour, but it's a rural area. We went to Mount Gambier, we went to Port Augusta, and we went to other locations as well. We had a phone conversation with staff from Ceduna, and all of these responses were pretty consistent. Mainly we spoke to staff who interacted with children and carers, so staff at the coalface. Occasionally we also spoke to managers in the different locations. And there was an overwhelming sense that caseworkers were seeking to do their job and fulfil their responsibilities to the best of their abilities. They found the issue of managing the legislative and policy requirements a challenge, whilst also seeking to ensure the safety and well-being of the child. And yet there were still the misunderstandings from both sides. Both carers and staff were seeking the same outcome, the safety of the child, but they each felt they had different obligations to different authority structures. And the literature around this is pretty consistent across Western countries. These were quotes from staff. The difficulty of carers being a parent to the birth parent while caring for the grandchild as a parent. That was something they recognised. Staff recognised the difficulty for carers of being a parent to the adults as well as being a parent to sometimes their own grandchildren or their own niece or nephew. I found this second dot point interesting. As a safeguard for the carers, the caseworkers would provide what they called a safety plan. So it took the heat off the carers and placed it on the agency. It would say, the carers would say, we've provided a safety, the staff would say, we've provided a safety plan in writing so that if the birth parent turned up on the doorstep, the kinship carer could say, it was not my decision, but was made by the agency. So that it took the heat off the kinship carers when, say, the birth parent was coming around and wanting to perhaps take the child. So the blame will be put on the agency. And the final dot point, obligation is the hard side. The carers need to do it. They have no choice. Commitment is when the head kicks in. So again, they recognise the deep emotional obligation on the part of carers to care for these children. Just finally, some outcomes. So there were points of agreement as well as points of disagreement between staff and kinship carers. These were the areas of agreement. The kinship carers and the staff saw their primary responsibility to keep the child safe. Kinship carers and staff saw kinship care as a valuable alternative to foster care. They shared concerns about stressful family dynamics and the birth parent context, and carers have the major involvement around handling family stress and negotiating the agency. So that item 4, that last point there, they felt like the meat in the sandwich. So kinship carers felt like the meat in the sandwich between staff and children, between staff and the birth parent, between the birth parent and the child. They were in that place. They couldn't escape all of those interactions. And that was a really stressful issue, often, for them to deal with. There were also some points of disagreement between carers and staff. Who has primary responsibility for the child? And that was, as I said early on, that was a really significant issue and not easily resolved. Both the staff and the carers felt they had ultimate responsibility for the child. At times, staff said to us that they didn't believe that the particular carer who was chosen was preferable for the child. So a particular kinship carer was chosen, and then the staff felt that mostly that was fine, they were comfortable with that, but just occasionally they really felt uncertain about that particular individual or couple having responsibility. A difficult question, but the particular carer chosen might be the best option as kin, but some of the staff still had reservations. And the issue which caused most angst, as I've said before, who has primary responsibility for the child? Is it the carer or the government agency? And how should this responsibility be implemented? So, thanks for your time. I did mention discussion points and references, but I won't worry about those now. I think what I'll do is just, if people want to chat to me afterwards, you're welcome to do that. I won't have the answers, but at least we can chat, and I'll be interested to hear your viewpoints as well. Thank you.
Thank you, Keith. Now, there's someone in the audience who can't see.